Dear students, let us see the image-based anatomy in the lower limb. Before answering this question, go through the topic of front of thigh in the book which you are following. Then observe the picture that is provided and look at the numbers. Total of 12 structures are pointed out with arrows. So the first question is, you should be able to name the structures 1 to 12 that are pointed with arrows. Take some time to go through it. Each one, so look at the structure 1. Which is a muscle. And then look at the structure 2, a vessel. Structure 3, a vessel. And then structure 4, a vessel. Structure 5, a vessel. Then structure 6, a muscle. 7, a nerve. 8, a nerve. 9, a muscle. 10, muscle. 11 also a muscle. And 12 also a muscle. So now let us see how to answer this question. So if you look at the number 1, it's a muscle. What is that muscle? It's the tensor fascia latae muscle. So this is the lateral aspect of the thigh, and then this is the medial aspect of the thigh. And most of the thing which you are seeing between this medial and lateral margins of it, most of the femoral triangle and front of thigh you are seeing. So this is the base where you will find the inguinal ligament. So now you could identify the tensor fascia latae muscle. Then what is this second one? It's a blood vessel. So what it could be? It's the lateral circumflex femoral artery. Then coming to the third one, which is also a vessel, that is the femoral artery. So here you are seeing a blood vessel coming from the femoral artery, lateral circumflex femoral artery you are seeing. Then coming to the 4, it's also a structure, and that is the profunda femoris artery. This is the profunda femoris artery you are seeing. Then coming to the number 5 is also a structure, and it is the femoral vein, which will be medial to the femoral artery, and still medial to it will be the femoral canal. All these three, you know, they are covered with the femoral sheath. Okay, so the femoral vein you can identify. Then the 6th one, this is the 6th one, which is a muscle, and this is the gracilis muscle, the slender muscle gracilis you are seeing. Then what about the seventh one? This is the seventh one. So what is the structure you are seeing is a nerve. So what is that nerve? It is the lateral femoral cutaneous nerve or lateral cutaneous nerve of thigh. Then coming to the eighth one. This is the eighth one. Again you are seeing a thicker bunch of nerves. So that is the femoral nerve. You are seeing. Then what about the ninth one? Again you are seeing a muscle on the front of thigh. And it is part of the quadriceps femoris muscle. That is the rectus femoris muscle you are seeing. Then coming to the 10th one is also a muscle. And it is the pectineus muscle. So which forms the floor for the femoral triangle. Then what about the 11th one? Again you are seeing a muscle and that is the sartorius muscle. So which forms the boundary for the femoral triangle. Then what about the 12th one? Again it is a muscle and it is the adductor longus muscle, which is also a boundary for the femoral triangle. So what you have covered in this image based questioning is the muscles of front of thigh and then the vessels and nerves in relation with the front of thigh, especially in the upper part. Now look at the second part of the question on the image based anatomy of lower limb. After answering the first question, naming the 12 structures that were numbered, then you attempt this question. You have to write one point about each of the numbered structures. So there are certain guidelines are given. That is, for a muscle, you should be able to tell its action or nerve supply. Think of both. That will be good. Then for a nerve, its root value and whether it is motor or sensory. For the artery, its origin and the branch or branches it gives. Then for the vein, its formation and termination. So these are the guidelines given for answering the question 2 of the image based anatomy of lower limb first session. Now let us continue answering the second part of the question, and here you have to identify the structures and write the relevant questions related to that. So the first one, you have identified it as the tensor fascia latae muscle, and what is its action? Abductor of hip and extension of knee through the iliotibial tract into which it gets inserted along with the gluteus maximus. So both of them, they act on the knee joint through the iliotibial tract, and this muscle is separated by the superior gluteal nerve. Then coming to the second one, it's a blood vessel and it is the lateral circumflex femoral artery. It's a branch of profunda femoris artery, but in this case you are seeing it taking origin from the femoral artery, which is a variation. And then coming to the branches of it, it will give the ascending, transverse and descending branches that take part in the cruciate anastomosis above and anastomosis around the knee joint below. So this should stimulate you to read about the lateral circumflex femoral artery and the anastomosis, that is the cruciate and anastomosis around the knee. Then coming to the third one, which you are seeing, it is the femoral artery, the large artery of the lower limb, and it is the continuation of external iliac artery in the abdomen and passing underneath the inguinal ligament, and it is a content of femoral sheath. And then the branches it will give are the superficial branches, that is the epigastric, external, pudendal and circumflex iliac branches. Then the deep branches are the profunda femoris, the deep external pudendal and the descending genicular arteries. So this should make you to read about the femoral artery. Coming to the fourth one is also an artery. Now you are in a position to answer this. So this is the profunda femoris artery, and it is a branch of femoral artery, and it will give the medial and lateral circumflex femoral arteries. Medial and lateral circumflex, but here both are arising from the femoral arteries. Then additionally there will be the perforating arteries. That's about the profunda femoris artery. And coming to the fifth one, it's the vessel, that is the femoral vein, and then it's the continuation of popliteal vein, and it continues as external iliac vein. This is also a content of the femoral sheath. Coming to the sixth one, it's a muscle, and it's the slender muscle known as the gracilis, and it is the adductor of thigh, and it also causes flexion and medial rotation of the leg, and it is separated by the anterior division of obturator nerve. So the obturator nerve is the muscle of the nerve of adductor compartment of thigh. So hope you have understood about these 6 structures. Now let us continue with the other structures. So what is that? Number 7. You are seeing a nerve, and you identified it as the lateral femoral cutaneous nerve or lateral cutaneous nerve of thigh, and the root value of which is L2 and L3, and it is a sensory nerve. Then coming to the 8th one, you are seeing again a nerve, and this is the femoral nerve. Its root value is L234 and formed by anterior primary rami of these 3 roots, and it is motor to sartorius muscle, and then the quadriceps femoris muscle, and it is sensory also. So it gives rise to the medial and intermediate cutaneous nerves of thigh and the saphenous nerve. So that is about the femoral nerve, which is an important nerve to be read. Then coming to the 9th one is a muscle, and it is rectus femoris. It is part of the quadriceps femoris muscle, which consists of 4 muscles, that is the vastus medialis, lateralis, intermedius and rectus femoris. So you are seeing the rectus femoris part, and its function is it's a flexor of hip and extensor of knee, and is separated by the femoral nerve. Then coming to the 10th one, it's a muscle, and it is called the pectineus muscle, and it is the adductor of thigh, and it is in the adductor compartment. So adductor muscle, which is separated by the femoral nerve and anterior division of obturator nerve. Both nerves will supply it. That is the peculiarity of this muscle, which has got dual innervation. Then coming to the 11th one, it's a muscle. It's called the sartorius muscle, which forms the boundary for the femoral triangle, and its action is it's a flexor of knee and hip, because it crosses both the joints, and it is also lateral rotator of thigh, and it is supplied by femoral nerve. Coming to the last one, this is the 12th one, which is also a muscle, and it is the adductor longus, and then it's a muscle of adductor compartment, and it also forms the boundary for the femoral triangle, and It's both adductor and medial rotator of thigh, that is its action, and it is separated by anterior division of the obturator nerve. So that is about the image based question 1 in anatomy, and where there are 2 parts of the question and we have answered them. Hope this is useful to all of you.